This is a nice lady that had a bump on her head and was wondering what it was. It was a very firm mass that was stuck to the forehead. So just by clinical exam, to me it was an osteoma, which is a benign lesion. And actually the next lady that I'm going to be working on in a couple minutes, she thought it was an osteoma, and it was a soft, ballotable. In other words, I could move it around and push on and squeeze it. And I said, no, that's a sebaceous cyst. So I'm about to take out something from the forehead that she thought was an osteoma, but it was not. This is definitely an osteoma. So what is an osteoma? It's basically a benign bone growth off the forehead, very common. And you see here she actually had two. And she actually said she suspected two. I only felt one. But when I took the big one off, I saw adjacent to it a very tiny one. And it's important to take the small one off as well, because if you just take the big one off, that small one, that baby bear, becomes a mama bear in a few years, and she's going to come back in my office and want another procedure, and this will save her that issue. I did a good survey around the zone as well. There were no other baby bears around there, so I've taken both out. The trick with this is you want to use rhinoplasty instruments to remove them, which is basically an osteotome, which is a flat blade to remove it, and most times it comes out quite easily, and it doesn't require a lot of work. I've noticed in some cases it can be actually quite difficult to remove it, where it actually needs a lot of rasping and repeated treatments with the osteotome. But oftentimes, if you're lucky, like this lady, it just comes off like a cleavage plane. It comes off very, very, very easily. And for hers, we were very blessed that both of them came off with one gentle tap. The incision is along the hairline. The incision line is interesting, is that oftentimes we think that if we make a very short, tiny incision, that it will become less obvious. But actually, an incision should be long enough that it sort of looks like a wrinkle as it fades, and you don't want a very long one, but just a long enough one that it doesn't look like a weird little tiny dot there. What I've done with the incision, besides mask it in the hairline, is I also used what's called a trichophytic incision, which basically means that I went against the grain of the hair follicles so that the hairs grow through the scar to make it more difficult. I've used a multi-layer closure as well. The first layer is a deep buried suture. I only used two of them, and so you think, I would need a lot of them to take tension off, but there's no tension because there was no skin removed. And the problem with using a lot of deep sutures is that there's a tendency for them to want to spit out, and then you've got to trim them away. So I only used two, and I didn't even use any on the left side because there was absolutely no tension when I put the two sutures in. I then closed it with interrupted, in other words, individual sutures to align the incision perfectly, and also further to take tension off the epidermal line. And then I close it with a running to make it heal very well and not have as many knots in that area. Then I use what's called a horizontal mattress, which helps eversion of the incision. Why evert the incision? Eversion basically means the incisions go up. That allows it not to sink in because you don't want a depressed incision. The good thing with a forehead incision is that it rarely inverts because of the underlying curvature of the bone and being so close to the incision line. So you don't need as many horizontal mattresses as you would, let's say, in the free cheek area that is far away from the a bone like the malar bone. Which actually, even if it's close to the malar bone, it's still too much distance that it can cause an inverted issue. In this case, I'm also using what is called 6 or 7 ovicral sutures, which are long-lasting. They stay in about 4 to 6 weeks, and they're very small. Of course, they look massive in this because it's a magnified view, but this is flesh-colored, and it really is hard to see. And I even found it in African Americans to not be really an issue. They don't really see because it's so tiny. It's like the width of a hair. Why use dissolvable stitches? Dissolvable stitches don't always work well. Sometimes they actually, like in the upper eyelids, I found them to not heal as well as removables. But I find that if you can keep the epidermis, which is the actual outer layer, approximated or touching each other longer, like 4 to 6 weeks, the healing is better. It does not cause what people always worry about as track marks. Now, in the upper eyelids, I found that it did do that. So you need to sort of use this in a very judicious fashion. But I find that if you can keep the epidermis, which is the outer lining of the skin, touching for more than about 3 to 6 weeks, then you get a better healing in the zone. And this is going to be something where She was nice enough to say, look, I don't care, I can wear bangs and cover it. No, I mean, my goal as a plastic surgeon is that if she wants to wear hair up, sideways, down, that this incision will be virtually undetectable unless you're probably within an inch and someone points it out to you. So this is a quick understanding of osteomas, how I approach osteomas, and probably everything you wanted to know or didn't want to know about the surgical technique involving them.